Hello, my name is Lauren Sear, and today I'm going to be discussing influenza B and C. So, key points. The flu affects millions of people worldwide each year. Influenza B and C are two types of viruses only found in humans. Neither type B or C can cause pandemics or epidemics, and the influenza virus accounts for 291,000 to 646,000 deaths each year. Influenza viruses are members of the family Orthomyxiviridae. This disease is an acute viral disease of the respiratory tract. Symptoms are usually accompanied with fever, dry cough, headaches, malaise, coryza, and sore throat. Coughs can be severe and last for 2 weeks or more, while fever and other symptoms usually resolve within 5 to 7 days. In children, GI tract manifestations such as nausea, vomiting, and diarrhea may occur with the flu. This is seen in about 25% of school-aged children. However, GI manifestations are not usually common in adults. Geriatric patients may not present with the typical influenza-like symptoms, but can express underlying conditions like congestive heart failure. This is why it's important for elderly adults to get a stronger dose of the flu vaccine. It can be clinically indistinguishable from diseases caused by other respiratory viruses. Symptoms during winter months can be enough information to consider it a flu. However, laboratory testing can be done to confirm that it is the flu virus. So hosts for influenza B and C, they are not transmitted via birds or animals like type A influenza, which is why there is less mutation and less transmission of B and C, and it transmits much slower. So seasonal flu outbreaks are a threat to all age groups, but the highest risk complications occur in children younger than 2 or adults older than 64. Risk also increases for people with chronic medical conditions such as cardiovascular, neurocognitive, renal, hepatic, hematologic, or hypertension disorders. Poor nutrition and less access to healthcare also play a role. People who are more likely to contribute to higher rates of complication and death, according to an influenza investigation done in Africa. Seasonal influenza can occur in any age group, but more than 90% of the deaths are in those older than 65 years old. Transmission. Control and prevention is done by practicing good hygiene, cough etiquette, and hand washing. Vaccinations can also be used as a protective measure. There's 2 main types: inactivated influenza vaccines or live attenuated influenza vaccines. And they can be effective in healthy adults. Elderly adults usually require a stronger dose of vaccination because the vaccine is less effective in their age group. The vaccine for influenza A and B should be administered before each flu season is expected in a community. And flu season on the national average is October to early May. In the California, when it's actually shorter than the national average, just because our summer comes a little bit sooner than the national average, and the heat helps end this flu season. Vaccines need to be administered each year to be the most effective in preventing the flu, and one reason for that is that the flu virus is constantly changing, and flu vaccines need to be updated from one season to the next to protect against the virus. And for best protection, everyone over the age of 6 months and older should be vaccinated annually. Treatment. Treatment of the influenza virus is most effective early on when symptoms are first noticed. Neuraminidase inhibitors given in the first 48 hours of symptoms reduce the chance of complications and death. Patients should be observed for bacterial complications, including co-infection with MRSA and antibiotics. Tamiflu, which is the brand name for oseltamivir phosphate, is an antiviral drug. It attacks the flu virus to keep it from multiplying in your body and by reducing the symptoms of the flu. Tamiflu can sometimes keep you from getting the flu if you take it before getting before getting like symptoms. However, it's not an alternative, but it can be combined with the flu vaccine to give you the best protection. And so the next few pictures are from the CDC's FluView Interactive website, and all of the graphs were retrieved on February 29th of 2020. So this first picture here shows the type of person most affected by influenza outbreaks. As you can see, the age group most affected is the 65 and older range. This graph shows the time frame when outbreaks are most likely to occur. The influenza season usually starts in October and ends in May, with its highest peaks seen in December. And then this graph shows the places where different strains of outbreaks occur. The most common strains are influenza A, but you can see that influenza B is still present in the population. And then here are the references.